Evening mobility routines can support joint health and sleep quality for adults over 50. While no exercise routine reverses aging or eliminates joint problems, gentle movement before bed may help reduce stiffness, improve flexibility, and promote relaxation. Today we're covering 5 gentle evening movements that address common areas of tightness while supporting better sleep. These can be performed at home with minimal equipment. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new movements, especially if you have joint problems, recent surgeries, balance issues, or other health conditions. Understanding evening mobility routines. Evening is often an ideal time for gentle mobility work. Body temperature is typically higher in evening, which may make tissues more pliable. Daily activities are complete, allowing focused attention on movement. Evening routines can promote relaxation, supporting better sleep. The movements will target common areas of age-related stiffness, including hamstrings and lower back, spine and torso, shoulders and upper back, hips and ankles, and overall circulation. While these movements won't cure arthritis or eliminate joint pain, regular practice may help maintain comfortable range of motion and reduce morning stiffness for some individuals. Movement 1. Supported seated forward fold for hamstring and back. The first movement is a supported seated forward fold addressing hamstring and lower back tightness common in older adults. Tight hamstrings contribute to lower back discomfort and difficulty with movements like bending forward. Here's how to perform supported seated forward fold safely. Sit on edge of bed or on floor with legs extended forward. If sitting on floor is uncomfortable, elevate hips by sitting on folded blanket or firm pillow. Sit upright with neutral spine, not slouched. Slowly walk your hands forward along your legs, folding from hips, not by rounding spine excessively. Only go as far as comfortable, feeling gentle stretch in back of legs or lower back. You may only fold forward slightly, which is perfectly acceptable. Hold this comfortable position for 60 to 90 seconds while breathing naturally. Focus on relaxing into the stretch rather than forcing deeper. To come out, walk your hands back and slowly roll up to sitting. Perform once or twice. Important considerations: this is gentle stretch, not intense pull. Discomfort should be mild. Keep breathing natural and relaxed throughout. Never bounce or force the stretch deeper. If you feel sharp pain, back off immediately. Modifications: if sitting on floor is too difficult, perform from sturdy chair by hinging forward with hands on thighs. Place folded towel under knees if they're uncomfortable straight. Use yoga strap or belt around feet to assist if you can't reach legs comfortably. What to realistically expect: with regular practice 5 to 7 times per week over 4 to 8 weeks, you may notice gradual improvement in hamstring flexibility, reduced lower back tightness, easier forward bending movements, and enhanced relaxation before sleep. Flexibility improvements are gradual and individual. Movement 2, Supine Spinal Twist for torso mobility. The second movement is a gentle supine spinal twist addressing rotational stiffness in spine and torso. Spinal rotation often decreases with age, affecting ability to turn comfortably. Here's how to perform supine spinal twist safely. Lie on your back on bed or mat with knees bent, feet flat. Extend your arms out to sides in T position, palms up or down, whichever is comfortable. Slowly lower both knees together to your right side, only going as far as comfortable. You may only go part way, which provides benefits. Keep left shoulder on surface as much as possible. You should feel gentle stretch through left torso and possibly outer left hip. Turn your head to look left, away from knees, if neck allows comfortably. Hold this position for 60 to 90 seconds, breathing naturally. Slowly bring knees back to center. Repeat on opposite side, knees to left, head to right. Perform once or twice per side. Key reminders: move slowly and gently, never forcing rotation. Keep movements within comfortable pain-free range. Breathe naturally throughout, don't hold breath. Both shoulders should ideally stay on surface, though some lifting is normal. Modifications: place pillow or folded blanket between knees for comfort and support. If rotation feels too intense, reduce how far knees drop to side. For very limited mobility, simply let knees fall slightly to one side rather than all the way down. What to realistically expect: with regular practice 5 to 7 times per week over 4 to 8 weeks, you may notice gradual improvement in spinal rotation, reduced torso stiffness, easier turning movements, and enhanced relaxation. Spinal mobility improvements occur gradually with consistent gentle practice. Movement 3, Modified Cat-Cow for spinal flexibility. The third movement is Modified Cat-Cow, addressing spinal mobility through gentle flexion and extension. This movement pattern helps maintain spinal flexibility, often reduced with age and prolonged sitting. Here's how to perform Modified Cat-Cow safely. Start on hands and knees on mat or carpeted surface, hands under shoulders, knees under hips. If wrists are uncomfortable, place forearms on surface instead of hands. Keep your back in neutral starting position. Slowly arch your spine, dropping belly toward floor, lifting chest and tailbone gently. This is extension or cow position. Pause briefly. Then slowly round your spine, tucking tailbone under, drawing belly toward spine, lowering head gently. This is flexion or cat position. Continue flowing slowly between these two positions for 60 to 90 seconds. Move at pace that feels comfortable, coordinating movement with breath if possible. Inhale during extension, cow, exhale during flexion, cat. Perform once or twice. Important form points: keep movement small and controlled. Large ranges aren't necessary. Move your entire spine, not just lower back or neck. Flow smoothly between positions without jerky movements. Keep core gently engaged throughout. Modifications: if hands and knees position is uncomfortable, perform seated version sitting upright in chair, gently arching and rounding spine. Place extra padding under knees if needed for comfort. Reduce range of motion if you feel any sharp discomfort. What to realistically expect: with regular practice 5 to 7 times per week over 4 to 8 weeks, you may notice gradual improvement in spinal mobility, reduced back stiffness, easier spinal movements, and enhanced body awareness. Improvements develop gradually through consistent gentle practice. Movement 4, Ankle and Hip Circles for joint mobility. The fourth movement addresses ankle and hip mobility through gentle circular movements. These joints often lose mobility with age, affecting balance and walking. Here's how to perform ankle and hip circles. For ankle circles, sit comfortably on bed or chair. Extend one leg slightly, keeping heel on surface or lifting foot slightly if comfortable. Slowly rotate ankle in circular motion, drawing circles with toes. Perform 8 to 10 circles in one direction. Reverse direction for 8 to 10 circles opposite way. Switch to other ankle and repeat. For hip circles, lie on your back on bed or mat. Bend one knee, keeping foot flat initially. Gently draw small circles in air with knee, moving from hip joint. The circles should be small and controlled, approximately 6 to 12 inches diameter. Perform 5 to 8 circles in each direction. Switch to other leg and repeat. Perform ankle and hip circles once or twice per side. Movement reminders: keep circles small and controlled. Large ranges aren't necessary. Move slowly and deliberately, feeling joints move through range. Stop if you feel sharp pain or significant discomfort. Breathe naturally throughout movements. Modifications: for ankle circles, keep heel planted on surface rather than lifting foot if balance is concern. For hip circles, keep circles very small if hip mobility is limited. Support leg with hands or pillow if needed during hip circles. What to realistically expect: with regular practice 5 to 7 times per week over 4 to 8 weeks, you may notice gradual improvement in ankle and hip mobility, reduced joint stiffness, better walking mechanics, and enhanced balance confidence. Joint mobility improvements are gradual and individual. Movement 5, Legs elevated against wall for circulation. The fifth movement is legs elevated against wall, a restorative position that may support circulation and relaxation. Elevating legs above heart level promotes venous return and may reduce leg swelling. Here's how to perform legs up wall position safely. Position yourself lying on your back near wall, with one hip near wall. Roll onto your back and extend legs up wall, scooting hips as close to wall as comfortable. Your body should form approximately L shape with torso on floor, legs on wall. Keep knees slightly bent, not locked straight. Rest arms at sides, palms up or down, whichever is comfortable. Close eyes if desired and breathe naturally. Hold this position for 3 to 5 minutes. To exit, bend knees, roll to one side, and pause before slowly sitting up. Sit for a moment before standing to prevent dizziness. Perform once. Important considerations: this is restorative position, not active exercise. Allow body to relax completely. Keep breathing natural and relaxed. If you feel tingling, numbness, or significant discomfort, exit position. Rise slowly afterward to prevent dizziness from position change. Modifications: if hips are too close to wall causing discomfort, move hips 6 to 12 inches away from wall. Place folded blanket or pillow under hips for elevation if lower back is uncomfortable. For very limited mobility, simply elevate legs on several pillows while lying on bed instead of using wall. What to realistically expect: many people report feeling relaxed and experiencing reduced leg heaviness after this position. With regular practice 5 to 7 times per week, you may notice reduced evening leg swelling, enhanced relaxation before sleep, and improved sleep quality. Effects vary significantly between individuals. Creating evening mobility routine: here's how to incorporate these movements into evening routine. You don't need to perform all 5 every evening. Choose 3 to 4 movements that address your areas of greatest tightness. Complete routine takes 10 to 15 minutes. Sample evening routine: supported seated forward fold, 60 to 90 seconds. Supine spinal twist, 60 to 90 seconds per side. Modified cat-cow, 60 to 90 seconds. Ankle and hip circles, 8 to 10 repetitions per direction. Legs up wall, 3 to 5 minutes. Perform routine approximately 1 hour before intended bedtime, allowing time to transition to sleep preparation. Practice in comfortable clothing in quiet space with minimal distractions. Important safety considerations: these gentle movements support mobility but require appropriate caution. Stop any movement causing sharp pain, radiating pain, significant increased discomfort, or dizziness. You should consult healthcare provider before beginning if you have recent surgery within past 3 months, severe osteoporosis with high fracture risk, uncontrolled high blood pressure or heart conditions, severe balance problems, acute injuries, or significant arthritis flares. These movements work best combined with regular daytime activity as tolerated, adequate sleep and rest, proper nutrition supporting joint health, and other healthy lifestyle practices. Realistic expectations for evening mobility practice: benefits from evening mobility routines develop gradually. Week 1 to 2, learning movements and establishing routine, initial relaxation benefits, possible mild muscle soreness which is normal. Weeks 2 to 4, movements feeling more natural, some individuals may notice slight flexibility improvements, enhanced evening relaxation becoming more consistent. Weeks 4 to 8, more noticeable flexibility improvements in practiced areas, reduced morning stiffness for some individuals, established comfortable routine. The goal is gradual sustainable improvement in comfortable range of motion and evening relaxation supporting better sleep, not dramatic flexibility transformation. Conclusion: these 5 gentle evening movements, supported seated forward fold, supine spinal twist, modified cat-cow, ankle and hip circles, and legs up wall, provide accessible evening mobility routine addressing common areas of age-related stiffness while promoting relaxation before sleep. Start at comfortable levels using all suggested modifications as needed. Practice consistently 5 to 7 evenings per week for best results. Progress gradually based on how your body responds. Listen to your body and stay within comfortable ranges always. Combined with regular daytime activity and healthy lifestyle practices, evening mobility routines can contribute to maintaining comfortable movement and supporting quality sleep. Thank you for watching. For specific concerns about appropriate evening movements for your situation, consult with a physical therapist or healthcare provider for personalized guidance. Subscribe for evidence-based information on mobility, sleep, and healthy aging, practical guidance respecting individual limitations while providing accessible approaches to maintaining comfort and function.